all around, and it is going to be another phenomenal conference and the only health science educators conference that is dedicated just to us. So we're very excited about that.
And Karen, I'll just add that the conference page is being worked on, which will include the registration, the call for proposals, the hotel booking link, and also make your case to attend letter that you could share with administration about why it would be such a good investment to have you attend, to support you to attend. And our goal is to have that built out by February, the week of February, the last week in February. So just keep checking our website for that. And I think that's it. Melissa, I'll hand it back to you.
All right. I would like to introduce you to Aaron. Aaron is here with us to discuss pharmacy programs. And I'm going to let him tell us a whole bunch about himself because I'm afraid I'm going to mess it up. Aaron, you can take it away.
That's fine. Let me get my screen share on here. Okay. So yeah, and I really appreciate you all for having me. I'm grateful for the opportunity to present to the group here today. So my name is Aaron Emmel, and I am a pharmacist. I've been very fortunate to have just a wonderful pharmacy career. I've worked in the community pharmacy setting when I was an intern during my pharmacy school years. I spent about 12 years working at my local community health system as a clinical pharmacist and eventually a health system administrator. I still moonlight from time to time in that health system. I specialized in critical care medicine and infectious disease. I've had the opportunity to teach at the college level with the College of Pharmacy with the University of Florida for both their doctoral program and the medication therapy management program they had. And I've also worked and consulted for the pharmaceutical industry and still do consulting for health systems for their quality programs. So I've been all over the place in healthcare. My wife is a nurse, and I've gotten to know so many different healthcare professionals over the years. And really, I thought I'd take the opportunity today to just discuss pharmacy technician education and why it's really such a good offering in schools. And I understand the majority of this audience is going to be high school educators. And I know a lot of you looking at the chat, you already have pharmacy technician programs. So excuse the first half of the presentation, which is really kind of the why it should be considered as part of a career and technical education offering. But we'll talk a little bit more about how to implement a program and what some of the considerations are. We'll address one of the questions that had already come in earlier. And if we have time, I'm going to try to get through this pretty quickly so we have enough time for a nice Q&A. I'd love, for any of you to share some of your successes as well. I've already heard at least one of you has had a very successful program, and we can all learn from each other on how this can be implemented and really empower your students to do well. So with that being said, we're just going to discuss, let me hide the chat here, just the pharmacy technician role. Who is a pharmacy technician? What do they do? Why this can really be a good part of a CTE program. So for those of you that don't have pharmacy technician education in your school system or district, you can make a value proposition to your leadership as to why this is a good thing to have. We'll talk some about the benefits of early credentialing for the student. So kind of the value proposition for the student to do this. And we'll talk about some support systems and resources for implementation. And my goal is really to just empower you, especially those of you that aren't doing this, to know how to do it. This can be done, on your own. It can be done in partnership with other people. Certainly, you should be looking to partner with your healthcare systems in your community, whether it's independent pharmacies or local hospitals, to really give students a good holistic experience. And hopefully we'll wrap this up with a good open discussion and Q&A. And what I will ask, because I'm having a hard time keeping the chat up and going through the slides. So if you, Nancy or Melissa, if you see a good question come in and you feel it's appropriate to stop me, please do. And we can address those questions as they come up. So pharmacy technicians are healthcare professionals. And I'll tell you the difference I've seen in the last 20 years since I first got into pharmacy to now, and what a pharmacy technician can do and the level of recognition and respect they have as healthcare professionals, there's been a substantial increase in the scope of the role, the importance of these individuals to the healthcare system, and really having a role in making sure that patients get optimal medication therapy, making sure that medication safety is at the forefront of the medication use system. The roles and responsibilities can vary greatly, and we'll talk in another slide or two about those depending on the setting. But historically, people thought of pharmacy technicians as people that just sat with a medication tray and counted by 5. And that's not the case. They do so much more than that. And again, are a huge part of the system that ensures patients get optimal care. And really, the healthcare system would be crippled without the function that they fulfill. And as we see more and more innovation in the space of healthcare in general, their role becomes increasingly important. And as such, it's important that they receive the education and training that they need to be able to perform the functions that they can now under most state laws. I like to talk a lot with students or prospective students and pharmacy technicians about the career setting in which they can work in. And again, most people assume you've got somebody that works behind a counter at a pharmacy, but there's so many opportunities out there for pharmacy technicians, whether it is the community pharmacy, working in a hospital setting, or other institutional settings such as long-term care facilities. There's acute like rehab hospitals, there are skilled nursing facilities, compounding pharmacies, nuclear pharmacies. I've even seen where cancer, hematology, and oncology practices will employ pharmacy technicians to make infusions that are given there on site. Insurance companies employ pharmacy technicians, pharmacy benefit managers. We're seeing a whole host of opportunities come in the IT space as there's more and more innovation with the building out of electronic health record systems, veterinary medicine, centralized operations, probably some other ones I'm not including on the slide, including academia. In fact, there may be some pharmacy technicians on this call, that do their own training and education programs. So the sky is really the limit for these professionals. This role was for a long time thought of as an entry-level position in healthcare, and it can be a good segue into other health careers, but it can also be a good career, for people that want to pursue a lifelong journey as a pharmacy technician. So and I'll blow through these slides really quick, but the community pharmacy is one really common setting where pharmacy technicians work, and they'll do anything from preparing medications to managing inventory, playing a huge customer service role, interfacing with insurance companies and doing billing, and procurement, again, as part of that managing inventory. We're seeing increasing roles with pharmacy technicians assisting in fulfilling medication therapy management services. So really helping pharmacists practice at the top of their license as well. Administering immunizations. So, I get my annual influenza vaccinations from pharmacy technicians. Our whole family got our COVID immunizations from a pharmacy technician. That's something I would have never thought that pharmacy technicians would do 20 years ago. But, with circumstances, the way that they unfolded during the pandemic, we got to see a huge increase in the scope of the role of the pharmacy technician. And again, interfacing with patients to obtain medical histories and medication histories, making sure there's a good documented health record for those patients, and many more functions as well. In the hospital, pharmacy technicians do many of those same functions along with some additional ones as well. They can even include interviewing patients in the emergency department and helping with the intake of that patient into the hospital in terms of documenting their history from a health and medication standpoint, distributing medications and playing a big role in ensuring all the patient care units are stocked appropriately, working with really cool technology when it comes to the automated dispensing machines and other things like that, and perhaps playing more of an administrative role than we see in a lot of community pharmacies when it comes to quality assurance projects. So again, pharmacy technicians can get a really diverse experience across these different care settings and these many other settings that we're not going over slide by slide that I mentioned a few slides ago. The one thing I can tell you firsthand, because I've had the great fortune to be able to work with a lot of organizations since I started the education program that I administer from an online didactic standpoint. I've seen firsthand the employers and the stretch that they've gone through over the past few years in terms of needing to find pharmacy technicians to fulfill roles. So I think in the last 20 years, we're still around the peak of pharmacy technician demand. You can pretty much perform a job search in any place in the country, and you're going to see numerous pharmacy technician openings. And for the high school students in particular, at least in the states where that they can be eligible for registration to work as a pharmacy technician, you've got employers that are willing to hire and train. And as I'm going to talk about in a minute, in terms of what's needed for pharmacy technician education and training, experiential training is really mandatory, regardless of whether or not it's part of the registration process. You need to get on the job training, and employers need pharmacy technicians badly, and they're willing to perform that on the job training. So this is a wonderful opportunity for your students to get these chances to go out into the job market and receive that experiential training they need to be competent in the role. So I've got some statistics here from the Bureau of Labor Statistics, and these are a little bit dated. My perception is that this doesn't quite paint the picture of the current opportunities for pharmacy technicians, but we see that there were over 450,000 pharmacy technician jobs reported in 2022. The growth of employment that's expected over the next 10 years is twice that of other occupations combined. The median annual wage that's reported is $36,000, but I can tell you, I've seen, especially in the areas of higher demand in the country, hourly rates in the mid $20 range, which is a substantial increase from what we were seeing even several years ago. Understanding that we're in a hyperinflationary environment, but still, this has been certainly part of that increasing scope of the pharmacy technician role is an increase in wage that we're seeing, and hopefully that trend will continue given the importance of the pharmacy technician. So kind of with that brief background on the pharmacy technician role, I do want to talk a little bit about why pharmacy technician education really should be a cornerstone piece of any career and technical education offering. There are many facets of career and technical education that align with pharmacy technician education. Hands-on learning, extremely important. And Regina, I believe that's on the call. Nancy was speaking before we opened this up to everybody about how you've been able to partner with some of your local independent pharmacies. And that's something I encourage of any health science educator that's doing a pharmacy technician program. Look for those opportunities in the community where the students can get that hands-on experiential learning experience, because that really is a core component of pharmacy technician education. Career readiness, you have the ability to provide education to these students, and if you do it right, qualify them to attain a national certification, which is required in a lot of states and certainly empowers these students to go on and start their careers. Interdisciplinary learning, it's not just pharmacy technicians working with other technicians. They're going to work with pharmacists, depending on the care setting, many other healthcare professionals, from nurses to physicians to other allied health professionals. Soft skills are a huge component of the pharmacy technician profession. You've got a lot of interfacing with patients, with other healthcare professionals, with people that are in high stress situations, whether it's due to health issues they're working through or, some of the stressful demands that come with working in a health system environment. And then, like I already mentioned, market demand. We're seeing historic demands for pharmacy technicians, and you can help the local market by supplying these individuals in the workforce. And there's a diverse array of skills that pharmacy technicians need to have, and that, the workforce can benefit from good training programs, really providing this skill set or sharpening this skill set amongst your students, whether it's attention to detail, organizational skills, customer service, which in the healthcare environment is just paramount to being good at what you do. It requires a lot of empathy. It requires being able to work through stressful situations. Speaking amongst health science educators, obviously there's a huge health science component to pharmacy technician education, from basic math to more advanced math and science knowledge, communication skills, technological proficiency, which is with every passing week becoming more and more important in any profession, but certainly in healthcare, as well as problem solving and ethical responsibility. and a real need to approach the job with a sense of altruism, which again, in my opinion, teachers bring to the table as part of what they do, and you can really empower your students to have that same approach working as a healthcare professional. I also think the nice thing about pharmacy technician education is that the skills and education that the students earn or gain from that education are transferable across many other career clusters. So in that career cluster framework of career and technical education. So I'll kind of explain on this slide. I've highlighted in the red issue here, these are kind of the core pieces of pharmacy technician education. Students get health science, they get human services, and they get science, technology, engineering, and mathematics. But in the green hues too, you have a lot of ancillary skills that can easily translate to other professions, not just health science, but other career and technical roles as well. And the purple ones may be less relevant than those, but the majority of these career clusters are really conveyed to the student when you're providing education that's relevant to a pharmacy technician career. So not only are you empowering the student to perhaps go out and start a pharmacy career, but you're empowering them to be able to translate those skills into many different careers should they determine that the pharmacy technician or pharmacy path isn't right for them. Now, one of the key facets of pharmacy technician education is empowering students to attain credentialing, and I'll explain a little bit more about that. And I'll also recognize some of the other members of the consortium as well that are represented here. So there are several accrediting organizations that provide credentialing to pharmacy technicians. The two main ones are going to be the Pharmacy Technician Certification Board and the National Health Career Association. So both of these organizations offer a credential that's known as the CPHT credential. So this is Certified Pharmacy Technician. And this is a credential that recognizes that an individual has attained the knowledge that is required of somebody to be a competent pharmacy technician. There's a little bit of a difference between the process for qualifying for the exam for either of these organizations that we'll talk about. But most states, or I should say pretty much the states that include certification as part of their credentialing requirement, so the registration requirement, are going to recognize the credential from either of these organizations. There's also other credentials as well that may be a little more specialized or advanced. So in particular, the Pharmacy Technician Certification Board offers a host of other certificate-based programs that are specialized certificates, as well as another certification called the Certified Sterile Processing Technician. So, for most students, the most appropriate thing is to start with the Certified Pharmacy Technician credential, but they can really expand their career opportunities by pursuing additional specialty certificates or certifications as well. And there is kind of a top tier designation credential known as the Advanced Certified Pharmacy Technician credential that really separates those professionals from others in terms of being good candidates for leadership roles, and certainly growing their career above and beyond, whether they want to be prominent in professional organizations or whatnot. It's also important to understand what's required from a regulatory standpoint to work as a pharmacy technician. And the pharmacy practice is essentially governed at the state level. So most states are going to have a board of pharmacy or a health professional licensing body that is going to be in charge of credentialing individuals to work as pharmacy technician. That's going to publish the rules and regulations that go with the practice of pharmacy. So I encourage all of you, if you're going to have a pharmacy technician education program in your institution, be familiar with what's required in your state. And we'll talk a little bit about that here. So every state's different, and I'm always hesitant to quote specific states because these rules can change really any time. But some of the common things across most states is there may or may not be an age requirement. So some states are going to require somebody to be 18. Some states don't have that requirement. So, even high school age students can actually go work as pharmacy technicians in some states. There's typically going to be a basic education requirement. meaning high school diploma or equivalent, or in some states, a stipulation that you're working towards that. Certification, so attaining that CPHT credential may be required. A lot of states do require that, and or completion of pharmacy technician specific education or training, which I'll talk a little bit more about in a future slide. Typically, there's going to be a background check required. A lot of states will simply require that an individual attest that they are a good moral aptitude or character. There's typically an application fee. And then there's typically going to be requirements for ongoing, maintenance of that registration, which may come with certification at a future date or a completion of a certain number of continuing education hours. And I've got a purposely vague slide here, again, because these things change all the time. But this is just kind of a graphical depiction of the states and what they require. So on this slide here, the red states are going to require a state-specific approved training program for pharmacy technicians, and I'll talk about what that usually means here in a moment. The purple colored states are states that require somebody to have that national certification. Or the state required training. So, but at the minimum, that national certification would meet that requirement. And the green states here don't specifically require certification or pharmacy technician specific training, but probably do have other requirements in order to register. We are seeing a trend that more and more states are either requiring certification or some sort of accredited pharmacy technician education. So to kind of expand on that, again, these standards vary by state. One thing to be familiar with is the American Society of Health System Pharmacists accreditation. So they do this in conjunction with the American College of Pharmacy Education, or ACPE, and they have an accreditation process for institutions that offer pharmacy technician training. And it's quite a rigorous process. You have to have a combination of didactic education, simulated education, and experiential education. And I believe it's around a 400-hour requirement, a combination of those along with meeting certain standards, both within the curriculum and for the program faculty. So it is a difficult accreditation to attain, but in those states that require it, you certainly need to be able to provide that experience to the student, or at least point them in the right direction where perhaps an employer would be able to put the student through an accredited training program. And again, in those other states that don't specifically require that ASHP accreditation, you may simply be able to just have your national certification or complete an education program that's recognized by the Pharmacy Technician Certification Board, or military-based training, or employer-based training. But again, when we talk about credentialing for pharmacy technicians, in many states, having that certification from the PTCB or NHA will satisfy that education requirement. And aside from just qualifying individuals to be able to work as a pharmacy technician, there are other benefits as well that are important to both the student and to the profession. So it's certainly a way to be recognized by your peers as an expert. Again, it may be required in many states. It improves their job candidacy. It certainly may increase their earning power, admittedly not by much, but the pay bump, may be significant enough to warrant the certification in and of itself. Certainly putting the student on a path for career progression and the ability to go on and attain those other specialty-based certificates or certifications. And in general, advancing the pharmacy technician profession. And I'm very passionate about the pharmacy profession, and I think collectively, the more that we can ensure that the workforce is credentialed and properly educated, the more good can be done for patients, and the more we can see the scope of pharmacy practice grow in the future. And the other thing I like about this too is, you may afford the ability for a 16, 17, or 18-year-old to get certified as a pharmacy technician. And that early win, can really kind of put some wind in the sails of the student and empower them, to go on and achieve whatever it is they want to achieve. But the opportunity to give somebody at such an early stage, a professional credential like that, is a really nice thing for them to achieve in the high school or secondary institution stage of education.
Okay, Aaron, can we stop right there and you can take a breath? And Regina, you want to
Sure.
Self, I think it kind of would flow in here. She was talking about like an extra credential for her. Are you,
Yes, my students, Tennessee will allow them to give immunizations, but they have to have a certain certification to do that. And I'm struggling. I'm very lucky that we have a partnership also with our Gatton College of Pharmacy, which is really close to us. And they offer us a dual credit. And so we have early admission to pharmacy school. So they do a lot of stuff for us, but and I have even asked them, can my kids, once they're certified, come over and take their certification immunization? Because I think that's given to farm students their first semester. But as of yet, we've not been able to make that happen. So do you have any suggestions of how I can go about it? And then also my students have struggled once their certification, like it has to be renewed every 2 years, trying to get recerted. So it seems like it changes every time I'm trying to get somebody recerted that needs to be. So I'm kind of struggling with those two things.
Yeah, so great questions, Regina. So I'll tackle the second one first, 'cause that's a little easier. So yeah, right now the PTCB in particular, and again, the PTCB and NHA are going to be a little bit different. And I honestly can only speak to the PTCB because the training program that I'm a director for, we are PTCB recognized. I'm very familiar with them. We haven't done anything with NHA, so I can't speak to that. But the PTCB does require 20 hours of continuing education for an every other year renewal period. As far as finding the education opportunities that will fulfill those, the PTCB does have a directory of continuing education offerings that will meet that requirement for renewal of the CPHT certificate. I'm assuming on the NHA website, you'll be able to find the same. And typically you're going to want to find offerings that are ACPE, or American College of Pharmacy Education, accredited to be able to provide those continuing education credits. As far as the immunization requirements, again, this is going to vary at the state level. And that's something I'm going to have to dig into specifically for Tennessee and get back to you. And Nancy, perhaps when we have this as an enduring material, we can add a comment or annotation to this so that that information is available for the educators.
Well, and I
That's
was
right.
going to say that when I got my flu shot back in October, I think, the pharmacist who gave me my flu shot, he said that I should get a pharmacy tech, that as a CPR certified healthcare professional, I would automatically be able to give injections just based on that CPR certification. I don't know if that's specific to North Carolina or specific that I'm an old person, but that's kind of where he went with it, because he was encouraging us to pursue that if it was something that we might be interested in at all.
Sure.
They won't let us in Tennessee, so we have to have an additional certification. And if somebody's NHA certified, can they take the courses through PTCB for renewal?
So that I can't clarify at the moment off the top of my head. I know you're not supposed to make assumptions, but if it's an ACPE accredited continuing education hour program, I would have to imagine that would apply. So I think you could apply that standard at a minimum, and you can search for programs, continuing education programs that are ACPE accredited. Or again, you could browse that PTCB program directory, and I presume that all of those offerings are going to be ACPE accredited.
Okay, thank you.
And we have another comment in the chat here. What is APHA? So the APHA is the American Pharmacists Association. They have some great resources for education and continuing education. So they're one of the major pharmacy professional organizations. I actually have a slide dedicated to that. So we'll talk a little bit more about that here in just a moment. But I'm going to minimize the chat and roll on through the rest of this so we can get some more Q&A in.
Thank you for taking a moment to answer those questions.
Oh, of course. I appreciate the engagement from the audience here. All already kind of mentioned this again, but this is more of that pitch to administration. If you're trying to get a pharmacy technician education program at your institution, I'm a big fan of setting students up for success. So I really think you improve student mobility by offering this, because they can go on and get the education, get an opportunity to perhaps work as a pharmacy technician, which again, for a lot of people is going to be a good career. It may set them on the path of maybe pursuing a career as a pharmacist. They'll explore other health careers as well, depending on the setting they work in. They may find they want to go on and be a nurse or a physician, an occupational or physical therapist, or any other type of healthcare professional. So you're really empowering that student to kind of explore these health careers early on. And even if they don't want to do healthcare, a lot of those skills are transferable to other valuable careers as well. All right, so for those of you that are already offering these programs, or those of you interested, I think this section might help, empower you a little bit to understand how to do this. Or if you're already doing it, maybe give you some extra tips or thoughts on things you can explore. Some of the key considerations to implement a program like this, I think number one, you've got to ensure that your education not only provides the knowledge that the students need, but qualifies them for credentialing. And we'll talk a little bit in a moment here on how to do that. Make sure you're utilizing resources that are credible. Obviously, I mean, this is just obvious stuff, empowering students to succeed. I really think it's important to complement didactic education with simulated and experiential learning opportunities. And I'll talk a little bit more about what that means. Make sure that these students have support for career guidance, and make sure they're accessible for all students. We certainly want to make sure there's equity in these opportunities across the student population. So some of the curriculum resources you'll want to be familiar with, depending on what track you want to pursue, or both tracks here, is to make sure the curriculum is going to align with those credentialing standards from the PTCB and or the NHA. The PTCB has a content outline for the pharmacy technician certification exam you need to familiarize yourself with, and the NHA has one as well with their certified pharmacy technician test plan. As far as qualifying, and I believe this is relevant to the question at the beginning of the discussion here, can anybody teach this? And I believe there's better experts on the call here in terms of what's required for the schools from a district standpoint. But to be able to qualify for the Pharmacy Technician Certification Board credential, you have to appoint a program director that's either a pharmacist, a licensed pharmacist, or a certified pharmacy technician. Now, if you've got a healthcare professional that's able to teach this material, that's not a pharmacy technician, well, the easy route there would be for that individual to go on and take that PTCE to get certified, and then they would be eligible to be appointed as a program director. For the NHA, their requirement is to simply be an accredited or state-approved institution or education provider and create that training program that would align with that exam outline. So in that example, assuming you're an accredited high school institution, then whatever applies in your district will still qualify you for the NHA EXCPT exam. Some of the core kind of knowledge domains that are common across both of those organizations are going to be medication knowledge and information, federal and state laws and regulations, patient safety and quality assurance, the order entry and dispensing process, which is going to include one of everybody's favorite, the kind of the pharmacy calculations and math, concepts around inventory management, billing and reimbursement, and administrative tasks. So I'm not going to get into a deep dive on the specific topics and curriculum because you can read that on those resources I've already mentioned, and we don't really have time. But these are going to kind of be core pieces of any education program that's intended to prepare individuals with the knowledge that's required for a pharmacy technician. I do want to share just kind of my observations. So, I do have, I'm the program director for an online, just didactic only education program that's PTCB recognized. And I've been doing that since 2020. I've been fortunate to have a lot of students go through the program, whether it's as individuals or as part of collaborating with employers or schools. And I've been able to learn a lot, through that process. good things and bad things, and things that we've done to improve based on feedback we've gotten. And these are some of the core things that I have seen that have been associated with success, or separate the students that succeed from those that don't. One of the most important is that time commitment. It is a lot of information to learn for somebody that has no healthcare experience, and the students need to have adequate time to learn the information. So it's one thing to have a curriculum, and whether you teach it yourself in the classroom setting, or you're supplementing it with one of the publishers like myself or other members of NCHSE that provide these online supplemental programs or other publication programs. It's one thing to give the students that information and they can, meet the requirements and check the boxes to get through it. But it's a whole nother to make sure they have adequate time commitment to this. So, this isn't something that can be done in a matter of weeks and a student's going to succeed. They need to be exposed to information over the course of months. They need to have a good study plan. They really should be supplemented with some outside experiential or simulated experiences as well. But that time commitment is a really important piece of this. So plan early, make sure there's, ideally a full school year to prepare somebody to go on and take one of these certification exams. This isn't something to really push, through these students that have a full course load in a matter of a couple of months. Being enthusiastic about it. This is both from a student and a teacher perspective. So the more engaged the learner is, the better that they're going to do. And certainly finding ways to spark that interest and really highlight the good that a pharmacy technician can do, and making sure that it's right for the student. This should be something that they really want to do, and not just something they're doing just because it's going to get them some credits. I really like sparking curiosity in students. So it's one thing to give them information, but it's a whole nother to make them genuinely interested to understand why. So, and I'm sure some of you are doing a wonderful job in your classrooms, and you're probably already doing this, but try to challenge yourself to think of ways to spark that curiosity in the students. Come up with interesting games and workshops for them to really think through and apply some of the information they're learning. And ultimately, all of this needs to be framed in the purpose of working in any health career, which is in helping other people. So I think a constant reminder as you're going through a curriculum and talking about different topics is relating it back to the patient and why it's important, and why approaching that job with the knowledge and skills that are really required for the role is going to do good for the population as a whole. So I find that the students that have adequate time, that are really engaged and want to do this for the right reason, they succeed. And the ones in my experience that haven't succeeded either didn't put in the time, or they weren't really as interested as they needed to be. So when it comes to seeking credible resources, I mentioned the Pharmacy Professional Association. So we already had a question about APHA. They've got some excellent resources. For my program, I use their online ebook library for pharmacy technicians as a supplemental resource. They've got a nice set of ebooks that cover, the knowledge from the certification exam, that cover medication information, pharmacy calculations, etc. The American Society of Health System Pharmacists has a whole litany of educational material. And again, they're really the kind of gold standard accrediting body when it comes to pharmacy technician specific education. The Pharmacy Technician Educators Council, who I believe is a member of the consortium as well, is kind of the preeminent organization specific to pharmacy technician educators. So I know they're working really hard to revamp that organization and get more engagement. So that's a resource to consider looking into. And most state pharmacy associations have resources as well for education materials, and certainly can supplement understanding what's required in your state. We already mentioned the credentialing organizations. And then there's other publishers out there that can help. And again, my goal is to really help you understand as to what's required. You can do this on your own. You can create your own curriculum. If you have the bandwidth to do that, that's great. If you need help or assistance, there are publishers out there that can provide supplemental information for your students. I'm one of them. There's other members of the consortium as well. The only advice I have is to just make sure when you're looking to work with a publisher organization, ensure that they have a pharmacy professional, that's engaged in the material, whether it's a pharmacist or a certified pharmacy technician. That would certainly be a key part of the vetting process. And that, I'm glad we kind of got through that because we've got a good 10 minutes or so to kind of have an open discussion. I'd love to entertain any questions. For those of you that are already doing this, please feel free to share, what's worked for you too, and what some best practices are. Again, I think this is a good collaborative environment where we can all learn from each other.
As we get there, I wanted to hit the chat first to be sure I don't miss everything that's there. But so, and I'm not pharmacy, so there's going to be some of this lettering and stuff that I have no idea what it means. But it says, does anyone have experience credentialing through AAH? I don't know what that is, but can you speak to that at all?
I'm Googling it right now.
Okay.
Hi, that was me. That's
Personally had-
American
I'm sorry.
Allied Health. Oh, sorry. American Allied Health. That's who AAH is.
I don't know that one. Can anybody else speak to that? So that's going to be another research item. So I've got a couple
About to
tasks
say-
now.
I was about to say,
AAH.
unless they're taking a minute to
Eh,
unmute, I don't see anybody saying it.
AAH is, they're a member of the consortium as well. The American Allied Health Association, they provide certifications. Paula, do you know, I'm sorry that I don't know for sure if they do pharmacy technician. Are you saying they do? You can unmute yourself if you want to, or.
Yeah, they do. So we were just aligning with them because all of our allied health programs that we offer here, or at least most of them, they credential. But pharmacy tech is one of them. That's something that we were looking at possibly bringing to our school. So I was just curious if anybody else uses them.
I would just make sure you confirm with them, like, what, if they're recognized in your state, if you're
That was
by-
going to be my comment.
Board of
Definitely check
Yeah.
with your state board of pharmacy or health credentialing organization. And if certification is required, make sure you identify which ones they'll accept. Because I can tell you most of the states that I've read, they'll specifically state, and it's usually PTCB or NHA. I don't want to unfairly exclude AAH, but that would be key.
Okay, thank you.
So I personally had a question. I teach 9th grade students, and our big thing is career exploration, get them a whole lot of different ideas of what they might. So I'm always looking for labs to do in class to have those hands-on activities to kind of show what that career would be, to kind of help guide them. And I know a lot of teachers on the Facebook page and stuff. Krista right now has given me some ideas of things to do, but just trying to find areas where there's stuff, because I don't know anything about pharmacy. I've had the High Point University pharmacy program come and do a compounding lab with my students as a guest speaker. But for me to do something just on my own on the semesters when they can't come, I just don't have a whole lot in my toolbox to be able to do with the students. So I guess my question is, are there good places to find any of those things that I can do that would help
Yes.
sell the programs?
Yeah, so when it comes to like a simulated experience in the classroom setting, there are a lot of different things you can do. I think one of the cool kind of exciting ones is that compounding lab, and there's multiple ways to do that. You can have mock compounding of solid and liquid dosage forms. You can have mock compounding of like intravenous dosage forms. I could certainly send you just some tips on how to do that in the classroom setting on your own, and the types of materials that would be required. I know we have Phyllis Johnson's on the call. I know she's always had some wonderful ideas on how to implement some of these activities in the classroom setting. Another one,
Oh, awesome.
people jump to compounding as kind of like, oh, the thing to have the pharmacy technician students do, or working with counting trays and things like that. But I think the underappreciated one would just be communication skills and working through different patient case scenarios, and how to work with empathetic communication. So I really think that one is kind of the most important. And it doesn't even necessarily have to be pharmacy technician specific, but there's a lot of resources out there on how to improve empathy and communication and work through difficult scenarios with patients. And I think that one, and you know, at the 9th grade level, you would know better than me as a high school educator. You know, that may not be quite something that they're accustomed to yet, but that's an extremely important skill that would not just be required of a pharmacy technician, but really in any profession. So that's one I would really explore first and foremost, and then I'd look
Okay.
at the compounding type things secondly, because that's not always applicable in all the settings. Another interesting one would just be kind of working in a mock electronic health record environment. And I can send you some suggestions on that as well, because again, that would serve them well, not just from a pharmacy perspective, but as in a healthcare perspective in general.
Okay. Victoria, do you want to expound any on, you said that for those of us who are teaching this, oh, I'm sorry, you're teaching pharmacy and don't have the background, you're on the struggle bus bed. You want to unmute yourself and say anything that you think might be helpful to you?
So our pharmacy program is through NHA this year. Last year we had Aztec. So NHA is a little bit easier, but I'm a 20-year paramedic. And so in my interview, they asked if I'd be willing to teach this. I told them, I don't know a lot about pharmacy, but how hard can it be? I give drugs. Oh no, I'm dying. I hate this class. My kids therefore hate this class. And I can't figure out anything quote unquote fun for them to do because I'm so lost myself. I'm literally taking the class as a student and trying to teach them. I've looked on like Teachers Pay Teachers and stuff like that for resources, but I'm not finding anything of substantial use, if that makes sense.
Yeah. Oh, I didn't know if that's addressed to me or anybody else here.
Anybody that can answer, I don't care.
So, you know, I'll speak to that. And I mean, my genuine interest in doing this was just to facilitate a discussion and really empower you all to be able to do this. So I'm not trying to kind of pitch what we have in our own program as well, but I think this is something to explore.
I'm looking for new ones too, Aaron.
Well, when you're looking, you know, across the various publishers that are available to you, I think just vetting out what types of support they can provide is important, because it's one thing to have just the enduring material that will supplement the curriculum and help you have a recognized training program and expose them to the didactic education, but the level of support's important as well. So, you know, maybe finding somebody that can offer some personalized support, that's willing to host some virtual classrooms for the students. It's, you know, willing to provide more, even if it's asynchronous communication as well, to help with the teachers. And that's one thing that I've found that's been helpful with the organizations that I work with is, you know, a lot of the teachers in those organizations, or if it's an employer-based organization, they don't have the bandwidth, you know, to handle all of the direct education themselves. So being able to supplement that with an asynchronous communication platform for the students when they have questions or need help for support, you know, offering some live virtual sessions for Q&A or education, or simply to discuss career opportunities. And then some support directly to the teachers as well that need some help with the curriculum piece, because again, it's a lot of information, even for healthcare professionals. When you start digging into medication information and deep into the other domains of pharmacy technician education, it's a lot to take in. And when you're busy with all sorts of other curriculum and classes, I can see really easily how it can be frustrated. And like you're saying, I mean, that frustration is rubbing off on the students as well and really dampening their enthusiasm.
We are running out of time, but I do see one hand up. Kellen, do you want to unmute yourself? And I hope I said your name right.
Hello. This is amazing. I joined late. My name is Colleen. I actually teach nursing for Department of Education. I run a nursing program, Clara Barton High School. We have 6 different programs, and I went to the Vision ACTE convention this year, and I came across a booth with they had the farm program, and I was so excited about this, bringing this opportunity to my school. And New York is not like the Wild Wild West. They have so many restrictions on who can teach it, what you can do, et cetera, et cetera. So what I did, and I'm doing now, I actually put my PhD on hold for the next 3 months. I took some time off so that I can enroll, so that I can take the course. I'm actually taking the course now myself. So I guess the question is, after I take the course, I'm a nurse practitioner, I'm still in practice. It's a little tough because it's pharmacy and it's not nursing. So I guess my question is, would I need to go and work as a pharm tech? Do you need that hands-on experience in order to teach it?
Oh, that is such a nuanced question. So I'll commend you first for putting your personal work on hold for the betterment of your students and their opportunities. So from a requirement standpoint, right, you don't necessarily need to have that experience. I mean, if we think purely and specifically in the state of New York, you know, they now have a pharmacy technician registration process, and to qualify for that, you have to be certified. And you can get certified without any experience as long as you complete a recognized or a qualifying training or education program. And that will show that you have the didactic knowledge, and you're already an educator and a healthcare professional, and that nursing background probably gives you enough to do a good service to the students in teaching them. Now, will you give them the same level of education as somebody that's got a lot of pharmacy experience? No, not necessarily. I mean, you're not going to be able to speak to specific pharmacy scenarios and have those years of experience to build off of, but that doesn't mean you can't do good service to the students. So I think the fact that you're willing to do that, to at least gain the knowledge and be able to convey that to the students, I mean, you probably would do a good enough job, because at the end of the day, my personal opinion is, it's one thing to get certified and get the didactic education, but the student really needs to get that experiential training before they're really competent to fulfill the role of the pharmacy technician. So whether or not you have it to convey it in the education is one thing, but they need to get it themselves. And I could go on a whole dissertation about who should do that, but I think with the demand we're seeing in the marketplace, the employers really need to be able to provide that experience for the new pharmacy technicians and train them. So as long as
I
they
was
get
gonna
those
say,
opportunities.
And I'm going to have to interrupt because we're running out of time. So I'm so sorry. Thank you so much, Erin, for being here today and for sharing. I feel like we could talk for a couple more hours about this topic, but time has run out. I wanted to remind everybody that you will receive a certificate for your 1 hour professional development within 2 weeks of the close of this webinar. And speaking of 2 weeks, in 2 weeks on February 21st, we have our next Wednesday webinar. It's with transfer about healthcare simulation use in the classroom. So be sure that you sign up and attend that webinar in 2 weeks for more continuing education. And then, as Karen said at the very beginning of the webinar, don't forget the National Consortium's annual conference in October. Be on the lookout for lots and lots of resources coming about that conference. We would love to see all of you join HSEA if you're not yet members, and thank you so much for your time today. If there's anything anybody else needs to say to close up, we're 1 minute past 5 o'clock.
Thank you.
Thank you all so much. You've been wonderful. And I'll make sure to follow up on those items.
Okay, thank you so much. Everybody have a great Wednesday, and we will see you hopefully on February 21st.
Bye, everybody.
Bye.